A lot of products have been introduced to the market to treat hair loss and maintain a healthy skin. Just how do you get to determine which works for you and which doesn't? On this week's episode, we will discuss this and much more. Thank you so much for joining me right here at the Southern Stan Mayfair Hotel. My name is Sarah Teshna, and this is the Skin Therapy Show. And once again, thank you so much for joining me on this week's episode of the Skin Therapy Show. I'm your host, Sarah Teshna. Joining me on set today is an IAT trichologist, Muli Musyoka. Welcome to the show, Muli.
Thank you very much.
Please just tell us more about yourself and what you do and how long you've been doing this for.
Muli Musyoka is a trichologist, and I have a background of hairdressing. Of course, I have a longer background of garbage collection and second-hand clothes salesperson. But I have a lot of interest in hair, and when I got into hairdressing, got into product development, and realized that there was a gap in hair restoration. People were losing hair, and the physicians in the hospitals were not answering it. Dermatologists were not answering it. And I said I will be the guy to sort that out. So I traveled to Australia, did trichology for 2 years, and came back home. And now I treat hair and scalp problems. I set up Hair Hub Trichology Center, which is the first clinic of its kind in sub-Saharan Africa.
Who is a trichologist?
Now, a trichologist is, I always say, is not a medical doctor, but it's someone who is trained to understand hair from the cellular beat. I mean, it takes 2 to 4 years of training on understanding how diet affects hair, anything you eat, anything you drink, any medication you're on, and any changes in the body system, or even mechanical changes, how they would affect hair and scalp, and then you learn how to treat that. So we treat and help we diagnose and help to treat hair and scalp problems. However, there are some conditions that by law we are not allowed to treat. Only doctors can treat them. So then we have to work together with doctors.
I was actually going to get to that, you know, because you've said that you diagnose and you treat, but then again, you've just said that you're not a doctor. So how are you able to do all this?
It's really dependent. You see, hair and scalp conditions are just like any other problem. So before you start any therapy, you need to understand what is happening.
Exactly.
You need to get the right diagnosis. And we could be losing hair in the same manner, but what is causing my hair loss is totally different from what is causing yours. So the ideal situation is that you get a diagnosis, I get a diagnosis, and then the treatment program will be formulated according to our diagnosis. So there are some things that will not need any surgical procedures or any invasive procedures that it's a supplement that a trichologist can say you need to take 1, 2, 3, or it's a topical treatment that a trichologist can say you 1, 2, 3. But then I looked at where I want to go, and I said no, I want to introduce hair transplant in Kenya. I want to introduce the use of stem cells, human normal stem cells, to regrow hair. I want to introduce the use of growth factors from your own blood. And that is when I realized then I will need to work with medical doctors, then together accomplish.
Okay. So does that mean that if I went to a hospital to get hair treatment or hair transplant kind of a procedure, I will have to come back to you?
Yes, you'll have to come back to us.
Interesting.
We don't have hospitals performing hair transplants in Kenya. And it's something that even if you're a general surgeon, you have to be trained. It's an art. It's a very intricate job, and it's quite time consuming. Again, it's a training that you really need to understand. You need to understand how hair grows. What is it that you want to transplant? Because it's not really the hair that we transplant. What we transplant is the root of the hair. And it's very different from different races. Different people have different curvatures of their hair root, and then that dictates how then do you harvest the hair follicle. Otherwise, you will go through a transplant the whole day and you have got no hair growing at the end of it.
And just to remind our viewers that today we are talking about healthy scalp and hair loss. In case you have any questions, please do not hesitate to ask our expert here. Our Facebook page is The Skin Therapy Show. Instagram and Twitter is at The Skin Therapy Show. Muli, I don't know whether you have a social media page. Maybe you can give it out.
Muli Musyoka on Facebook and on Twitter, and Hair Hub on Facebook as well.
Okay.
Yeah, and Instagram, Muli Musyoka.
All right.
Yes.
Awesome. So let's delve straight into it. What are the most common causes of hair loss?
What we're seeing in ladies because ladies are more affected.
Yeah.
It's the most common form of hair loss in female of African descent is traction, where we call it self-inflicted form of hair loss, where ladies pull out their hair through either braiding, tight ponytails, or too much weaving, or putting on very tight wigs, and they cut off their hairline, which is made of baby hair.
Yeah.
Then, of course, genetic thinning or balding in men. And we're seeing also a lot of stress-related forms of hair loss. We have autoimmune conditions where your own white blood cells start attacking your own hair follicles. If you have too much stress going around.
Exactly.
And then, of course, we're seeing a lot of deficiency-related forms of hair loss, and more of that I see with people of the Asian community. Yeah, and then we also have fungal infections, where when we were young, what we used to call mashilingi. We call it tinea capitis for adults.
Yeah.
And we're seeing a bit of that as well. Yeah.
Okay. So in your own words, how can you define a healthy scalp?
One, a healthy scalp should not be itchy. If you're itching and you frequently find yourself sticking a pen on your scalp, there's a problem.
Yeah.
Or if you find yourself knocking off your scalp, there's a problem. If you're flecking, then you need to seek advice. If it's a dry, flaky scalp, or you have another problem, because sometimes we have flecks which are stuck on the scalp and in different spots, and someone just comes and says, I have dandruff, but you realize they have a bigger problem, something like psoriasis, which it's an autoimmune condition. So anytime you realize that your scalp is not usual, it's getting dry too quickly or faster than it used to, or you're itching or you're scratching more than you used to, then you need to seek help. Yeah. So an healthy scalp should be able to keep moisture in it within 5 to 6 days in a week, so you can oil your scalp once in a week. Because again, where we live in the tropicals, and it's pretty hot, and definitely your scalp will be dry, but it shouldn't be too dry that you have to too frequently keep putting oil or grease on your hair.
Yeah. So by keeping moisture, do you mean you regularly keep on oiling your scalp?
No, different people will lose moisture in different rates. There are people who will need to oil their scalp like 2 times in a week, but there are people, if they just oil their scalp once in a week, then they're okay. Because it also depends with how quickly you produce sebum, which is a natural oil which mixes with sweat to protect your scalp. It creates something we call mantle acid, which is important to protect your scalp from bacterial infection. So again, if you shampoo your hair too frequent, then you do not give time to the natural oils to take care of your scalp. So again, you need to strike the balance.
Okay. So how do you get to determine that the cause of my hair loss? How do you get to know whether it's my diet or the stress, or maybe it's the kind of products that I am using as a trichologist?
What happens is that there are things we call clinical features. That when you walk in, we have a long document that we ask you a lot of questions, and even before looking at the hair, we listen to your story. First, we want you to tell your story. What are you experiencing? And we get an history of where you're coming from. Then after that, then I look at your hair. If we need to put it under a machine, trichoscope, and magnify it and see it on a big screen, if we need to do that, then we do that.
So balding is a form of hair loss.
Yes.
How comes it comes early to some people and a bit late to other people? What's the difference?
It's the same way that some people will grow beards earlier than others, or they'll grow gray hair.
The white hair.
Yes,
the gray hair, sure.
It's really more of a genetic programming. However, having said that, there are things that can accelerate. For instance, if I was to get gray hair at the age of 45, and I smoke a lot or I drink a lot, then it could lead to stressing the body to a level that I start getting gray hair at the age of 35. If you were to bald, for instance, I saw, when I did the practice in Australia, I saw a gentleman who was working in a financial institution, and he started balding at the age of 24. And it was really accelerating.
Is that common? Is it common?
Yeah, we expect people to start balding at the age of 27, 28, though it's not abnormal to see someone thinning out at the age of 20.
Yeah.
Just the hair starts thinning. But to see it really accelerating at that tender age, 24 is not tender, but really it's young. Looking
That's a bit young, yeah.
So this gentleman, he decided to stop his working in that institution because he was really saying it was stressing him. And his hair loss completely slowed down. So there are some things that can accelerate the genetic hair loss to manifest earlier than it was supposed to. However, it's not abnormal to see someone in their early 20s and they are losing hair in a genetic related manner.
No, okay.
Yeah.
Interesting.
Yeah.
Okay, now I will now take you to my co-host who will, of course, have a conversation with Muli over here, and we get to see more on the treatments and how to take care of your scalp. Do not go too far.
In today's day and age, with all the chemicals that we use, all the weavings, all the dangerous stuff that we do to our hair, our scalps feel left out. Don't you worry, we have a product, Russia, that I'm going to take you through that could make all your scalp problems go away. Join me, Roshanari Ibrahim, on this episode of the Skin Therapy Show. Is it for all hair types or just henna hair?
All hair types for African hair.
Alright.
Then after, we're going to take now the treatment. Just a small amount, that's enough.
That's my favorite part of my hair care routine. Condition, condition, condition. You can never have enough. How long does that stay in the hair for?
5 to 10 minutes.
Okay.
Yes. So if you're going longer, 10 minutes tops. Then after that, comb gently. Especially when the hair is wet, you start from the tips going downwards. If you start from the bottom, the client is going to suffer hair loss, and we're trying to avoid that. So after that, we're going to do the press release.
So this is a
Press
technique.
release.
It's a series of techniques.
And that's 7 minutes.
Okay.
You have to time yourself.
Last step, as usual, the most important, moisturizing. Show us how this is done. Is there a special way?
Like I said again earlier, this is a cleanser cum moisturizer
Okay.
for your daily use. The way you oil your face, your skin, you need to do this every single day.
And what's interesting about the texture of the scalp cleansing oil is, like a lot of oils, it's not thick and it's not going to dirty your hair. It absorbs very fast and it keeps your hair clean all the time, which is why this is my preferred oil.
So we take a good amount into the palm of my hand, massage into the palms of my hand, then spread it to the hair.
For our viewers at home, stay tuned. We still have a bit more coming for you.